Hi, I'm Connie Franklin, and I'm here today with Dr. Anu Bajaj. She is certified by the American Board of Plastic Surgery, and we are going to have some amazing conversations today. Big hot topic of the moment, of our moments in both of our lives, as well as a lot of our own patients. Um, Menopause. What's the Give me your first thing on the top of your head of when I say the word menopause.
First thing I think of is hot flashes and just gaining weight. I don't know. That's what I think of.
Did your mom teach you anything about menopause?
No. So I do think this is the reality. I think we focus on women during their childbearing years. And so once they can no longer have children, which is what happens after menopause, we ignore it. So nobody ever talks about it, ever. Even your OBGYN rarely talks about
Right. Well, I've been talking about it nonstop.
it.
I talk about it at work. I talk about it at book club. I talk about it. And then I was trying to tell my mom I got this book, and it's like all these symptoms of menopause. So many things, right? Fatigue, joint. I mean, you always thought, okay, weight gain, hot flashes, and no more period.
Right.
What's the truth?
The truth is it's way more than that. And because it affects every aspect of our lives. And it's one thing for me to say that it affects everything related to your skin quality, to your weight gain, to your joints, to your bones. As a plastic surgeon, I guess what I get most concerned about is how it affects our skin quality and all those other changes that occur to our bodies and how that ultimately affects my patients as they pursue surgical and non-surgical options in the plastic surgery or aesthetic realm.
Right. So menopause and plastic surgery. How do they go hand in hand?
Multiple different ways. Well, first of all, as a plastic surgeon, I would say 85 to 90% of my patients are women. Most of my patients are in their 30s, 40s, and 50s. So those are the women that are starting to experience these symptoms. Those are the people I take care of. Other ways in which it affects plastic surgery is women are coming in either for non-surgical options, like how to improve the appearance of their skin, how to improve the sagging that they see in their faces and their necks, or they're coming in because their breasts have become deflated and are sagging, or they're coming in because they have loose abdominal skin. And those are the most common reasons why I see women come in, but all of those things are also affected by the changing hormones that occur during menopause.
Right. Interesting. And so, what sets you apart as far as a patient coming in? What are the resources you can offer instead of, go to 7 different doctors for all these different things? What can they get from you?
So I'm primarily a surgeon. So I don't, do a lot of I don't do any of the hormonal or weight loss things. But what we try to do with our practice is when you come in for either a non-surgical or surgical consultation, we want to provide a comprehensive approach so that we can figure out how we can optimize what your treatments are to fit your goals, and then also how to maintain everything afterwards. And I think that's what's really key in discussing how we can incorporate the treatments for menopause within that. With the signs of menopause that occur, or the effects of menopause that occur with our skin, I think that if we start when we're younger, before we reach menopause, we can minimize those long-term effects. So what happens when we lose estrogen is our skin begins to lose collagen. It loses its elasticity. It loses its supporting structure.
Mm-hmm.
The other thing that happens to our skin as we lose estrogen is that we decrease the production of oils in our skin. So that's why our skin becomes drier as we age. And so there is a significant component of how menopause affects our skin quality. And what I see is, as a woman, patients will come in and they're like, I didn't notice it. And then all of a sudden I just look old.
Yeah.
And we feel like it occurred overnight, even though it was more gradual. And the statistics show that within the first 5 years of menopause, as a woman, you lose 30% of the collagen content of your skin. So that's probably why we feel like it's accelerated after menopause. So, in terms of plastic surgery, can I change all of that? No. Do we hope that if we had started taking care of our skin in our 20s and 30s when we still had healthy, collagen, glowing skin, that we can have less of an effect once we reach our 50s? Yeah, we kind of hope that, but it's hard to know.
What are the expectations that you set for your patients when they come in for either an abdominoplasty or a breast lift? Because those are things that happen with the reduction in skin quality and skin elasticity, collagen. Things are sagging. Can we just put them right back up? Are they going to expect to have 20-year-old body again?
So anytime we do surgery, it doesn't stop the aging process. It's not a frozen moment in time. After surgery, you are going to continue to age. And the issue with our breasts, for example, it's not just skin. There are ligaments in our breast called Cooper's ligaments that help support our breast tissue. They also lose their collagen and elasticity, which is why your breasts continue to sag and why your breasts will change. So, from a breast surgery standpoint, yes, we can lift them, we can augment them, but with time, if your skin quality is not very good, you will see some more droopiness, say 10 years from now. With an abdominoplasty, we remove the excess skin, and there's not as much stretching that occurs there once that skin is removed, and if you're not going to have any additional pregnancies. Now, if you have weight gain and weight loss, you're going to see that stretching and contracting, which will result in more loose skin. So, in order to maintain the results, for example, after an abdominoplasty, I think one of the key components is maintaining your strength, maintaining your core strength, maintaining your body strength, and also maintaining your weight, which goes back to another thing that's really important for us to do once we hit it's important for us to do our entire lives, but it's critical in our perimenopausal years, is strength training to maintain our muscle mass and bone mass, which also decreases once we lose estrogen.
We don't want to be that person in our 60s, 70s, 80s who falls and breaks. Menopause, aging, and faces. Where do you stand, and what are your, golden rule of thumb for what you would recommend there?
So, as I mentioned, as we enter our perimenopausal and menopausal years, there are significant changes that occur to our skin, and that's related to the hormonal changes. One is there's a drying of our skin. The other is the loss of collagen and elasticity to our skin. And those are probably the most critical components. In terms of the aging process, the other thing that ages people, which is unrelated to menopause, is sun exposure and smoking. Those are the two biggest culprits besides our natural aging process.
Right.
So the go-tos for anybody are in their 20s and 30s to start using a sunscreen or sunblock
every day.
And
even
then,
on cloudy days?
Even on cloudy days, because the light still shines through. And then to start using a retinol product, which is a vitamin A derivative, because that helps to increase cell turnover and also increases or stimulates collagen. And starting at a younger age, we hope that once we hit our perimenopausal years, we can minimize all those changes. What is frustrating for many patients is they've lived their 20s, 30s, and 40s and not used sunscreen, not used a retinol product, and now their skin already has significant sun damage and the consequences of aging. And while starting in your 50s is great because sooner is better than later or never, it's not the same effect as if we had been taking care of our skin earlier. We still have changes in the texture of our skin and in the quality that, we can do multiple things, but it can't be reversed or improved upon overnight.
We saw that statistic about women wait until they see the signs of aging before they start doing any changes in as far as skincare, anti-aging skincare
Right.
or anything like that. So when is it too early? Is there a too soon for anti-aging products?
From the standpoint of using a retinol and sunscreen and a cleanser and a moisturizer, those are things I think you can start safely in your 30s.
Okay.
Sunscreen, you can start in your 20s. I mean, you
Right.
should be starting it before that, but yes.
Yes, as soon as you're
Cleansing,
in your 20s.
sunscreen, and moisturizing, that's the basic that
Mm-hmm.
you can do in your 20s.
Always be doing
Other types of treatments that a lot of women will pursue are things that other treatments that stimulate collagen, such as laser treatments, microneedling treatments, other things that will improve your skin quality, or soft wave, which improves the collagen and elasticity in your skin. I think 30s is a reasonable point at
that. Mm-hmm.
which to start that.
So if someone were to look at you and say, "Oh, but you have great skin quality. You don't need to use these, soft wave, that collagen boosting treatment. You don't need sunscreen. You're darker skin tone." What are your thoughts?
Um, that it's completely false. And, I'll be honest, I have ignored my skin for many years. And I too used to believe that I didn't need sunscreen because I tan and, as opposed to burn, right? That's
Mm-hmm.
what we hear. But I still re- will experience the signs of aging. And what I see it or saw it in is in my mom, my aunts, my grandmother. All of these are women who are also darker complected,
Mm-hmm.
generally have good skin quality because we're all the same genetics essentially,
Yeah.
but they still have the signs of aging where their skin is drier, they have a coarse texture, pigment irregularities. So, yeah, part of the reason why I'm looking good now is because I have been doing these things for many years. Now, I didn't start all of them in my 30s,
But you started sooner than they
but
did.
I started sooner than they
Mm-hmm.
did. I started probably in my mid 40s.
Okay. What other body parts are so affected by menopause that we want to be able to offer something for that? And I'm talking about FemTouch. I'm talking about vaginal health now.
So, the other aspect that's affected by menopause is obviously our genitourinary system, aka everything down there, I guess.
Mm-hmm.
I don't know how else you phrase it. But it also loses collagen, which is why we experience symptoms of vaginal dryness and itching. Um, and what does help with some of those symptoms is estrogen replacement, specifically vaginal estrogen.
Okay.
Another thing that does help is FemTouch, which is a fractionated CO2 laser treatment that you do on the vagina that helps to stimulate collagen, just in the same way that fractionated CO2 lasers help to stimulate collagen development on your face.
Right. Yeah. And then how quick is this treatment? How like what are some of the benefits and what to expect?
So, with the FemTouch treatment, the treatment takes less than 15 minutes. It's outpatient. You come to the office and one of our nurses will perform the procedure. It's painless. So, what it does do is, since it's stimulating collagen, it's been shown to decrease the frequency of UTIs, which is another symptom that occurs during the perimenopausal, menopausal years due to the loss of estrogen.
Yeah.
It also improves vaginal dryness and pain with intercourse because of that improvement in the moisture and quality of the vagina.
So if someone feels like they need a medical excuse, then just say it's because of my UTIs. I need to come in for some FemTouch. But really, you're getting all these other benefits too. That replenishing the collagen and stimulating collagen there with the dryness. It helps with the sexual sensation. Um, I've done it, and my biggest reason, my the reason why I'm doing FemTouch mostly is the urinary incontinence and the urgency. I'm a mom of two, so when we're talking to patients about the reasons, one or two, if not all of the benefits is going to speak to somebody, and whichever one that is, it's like, okay, then like let's do it. But when is too soon for that? I mean, is somebody should somebody wait until they're having symptoms, or on the, what are your recommendations for that?
My recommendations for that are to wait until you're having symptoms, which typically occurs in your 40s. And one of the earliest reasons why I started using FemTouch is because I had stress urinary incontinence. Basically, when you're working out or you're coughing or you're sneezing or whatever, you have a little bit of leakage. And that's where I noticed the biggest difference.
Yeah. And one and done, series of treatments.
It's typically a series of 3 treatments, spaced 6 weeks apart, and then annually after that.
Yep.
Just like many things, you have to start it, load it up, and then maintain, because rarely, the other thing I'd have to say about plastic surgery or health in general is rarely is anything a one and done. It requires maintenance. Just like if you work out and build up your strength, you have to maintain it and do it every day. Just like we brush our teeth every day, just like we floss our teeth every day. We should wash our skin and hydrate it every day.
Right. It's like you mentioned, we're not stopping the clock. We're not turning it back, but we can do these things to help with the symptoms. Well, thank you. I think that was really informative. I hope that you guys all enjoyed this menopause-related conversation. Was there any last thoughts that you want to add before we close out?
I don't know. I can never answer that question.
Well, sometimes, we'll be talking and there might be a little something in the back of your mind. They're like, as soon as I get the opportunity, I'm going to jump in.
I didn't have anything.
Add this. Okay.
Yeah.
Then I guess we covered it. Thank you very much. Call us at Bajaj Plastic Surgery for collagen stimulation head to toe. Thanks for watching. Now do me a favor, hit that like button and subscribe.